Hi, I'm Cassie, and today I will be talking about healthcare delivery in Spain versus in the United States. The United States healthcare system is a mixed system regarding insurance and healthcare costs. Public health insurance is paid for through taxes by everyone and only provided to individuals who meet the specific criteria to qualify for it. It's called Medicare or Medicaid, depending on the type and the benefits. Private health insurance is commonly used, often provided through employer or sometimes scholastic institutions attended by the covered individual. Healthcare consumers commonly pay out-of-pocket expenses if uninsured or partially insured. Most healthcare institutions in the United States are private, although some receive public funding. In Spain, there is universal healthcare insurance. Healthcare is seen as a constitutional right. Healthcare is funded to all through taxes paid by all citizens. No out-of-pocket expenses are paid, other than occasionally prescription medications. Public healthcare institutions are predominant in Spain, and although private institutions do exist, they are predominantly used by wealthier citizens. Infant mortality. In 2017, in the United States, the infant mortality rate was 580 per 100,000 live births. In Spain, in 2016, the infant mortality rate was 260 per 100,000 live births. Infant mortality is defined as the death of a child before their first birthday. In the United States, infant mortality is a very serious issue, as the U.S. has the highest infant mortality rate of any developed country in the world. In Spain and the U.S., there are downward trends in infant mortality, as you can see here with Spain. And in the United States, infant mortality varies greatly by region. So, different states in the Midwest and in the South have significantly greater infant mortality rates than that of the national average. Healthcare spending. In 2017, the United States per capita spent $10,209 on healthcare. In 2017, Spain spent $3,371 per capita on healthcare. There is a huge difference in healthcare expenditures between these two countries. A common sentiment amongst U.S. citizens is that providing healthcare insurance for everyone will lead to major financial burden on citizens, which may not be the case after taking into account the expenses that Americans pay out of pocket annually. Beyond the major difference of healthcare provided to everyone through tax expenses, there must be other factors to attribute to the major difference in health expenditures. Healthcare system influenza vaccination. In the United States, 69,100 out of 100,000 adults over the age of 65 received the flu vaccination in 2015. In the same season, in Spain, 60,000 per 100,000 people received the flu vaccination who were adults over the age of 65. In 2017, in Spain, 51,400 out of 100,000 adults over the age of 65 received the flu vaccine. These statistics show that the vaccination rate in Spain may be on a downward trend. The recommendation in Spain is that people over the age of 65 receive the flu vaccination, but only half of the regions in Spain recommend the vaccination for those less than 60 years of age. The United States is very different, as public health measures commonly promote receiving the flu vaccine for children, older adults, and just about anyone in between. Public health and prevention, tobacco cessation. In the United States, There is a wealth of smoke-free policies in the workplace, public and private institutions. Prices have been raised on tobacco products, and there has been major health media campaigns against tobacco use that demonstrate and raise awareness about the negative associated health outcomes. Smoking prevalence in the past 20 years in the U.S. has decreased significantly, and in 2015, smoking prevalence among males 15 years or older was 19.5% in the United States. Spain has similar policies on smoking in the workplace and public areas, and high control on sales, supply, consumption, and publicity or advertising of tobacco products. Smoking prevalence among males 15 years or older in Spain as of 2015 was 31.3%. This graphic here demonstrates and provides the data of smoking prevalence of males 15 years or older throughout the world. As you can see here, Spain is significantly darker, indicating that they have a significantly higher prevalence of smoking than the United States, which is in a lighter color. Air quality. In the United States, there is a strong relationship between type of landscape and development and pollutant levels. Various policies and regulations have made a positive impact on air quality in the United States. Some suggest that more emission control mechanisms are called for. In 2016, the concentration of fine particulate matter in the United States was 7.4 total. In Spain, there are similar emission policies, and from 2001 to 2012, there was a significant downward trend in air pollution. In 2016, the concentration of fine particulate matter in Spain was 9.5 total. Primary and specialty care. In the United States, there are roughly 242.2 physicians per 100,000 people and 124 psychiatrists per 100,000 people. Data was not readily available for statistics regarding amount of nurses and midwifery personnel per 100,000 people for the United States. In Spain, there are roughly 395.7 physicians per 100,000 people, 511 nurses and midwife personnel per 100,000, and 80 psychiatrists per 100,000 people. The lower number of psychiatrists may reflect different cultural beliefs around mental health. Physicians in Spain are more plentiful and psychiatrists are not. The medical model predominance in the U.S. may account for the lack of statistics or prevalence of nurse midwives when compared to Spain regarding birth. Social and economic environment. In the United States, as of 2016, there were 2,100 teen births per 100,000 people. In Spain, as of 2016, there were 900 teen births per 100,000 people. As you can see here, this line indicates the United States statistics, and this line represents Spain. Both countries are experiencing somewhat of a downward trend, although the United States has a significantly more severe downward trend than that of Spain. Another thing of note is that the teen birth rate has always been significantly lower than that in the United States. In some areas, such as vaccines and smoking, public health measures have had a positive impact that is more evident in the U.S. prevalence rates. Pollution regulations made in the past have positively impacted air quality in both the U.S. and Spain. The U.S. spends a considerable amount more on healthcare, with not many health measures considerably better than Spain. Some health outcomes, such as infant mortality, are better in Spain when compared to the United States. There are more physicians in Spain, and emphasis on other healthcare personnel, such as nurses and midwives, which may contribute to better health outcomes. Difference in cultural beliefs may account for the major differences in the belief of healthcare as a right, higher rates of tobacco use, and significantly lower rates of pregnancy. Overall, both countries have healthcare systems with their strengths and weaknesses, and perhaps could learn from where the other falls short and is strong. Thank you. These are my sources.